Hello everybody. Let me make sure that my volume is up. How are you? We're going to be talking about a subject that is near and dear to my heart, which is managing sexual expectations, birth control, and teaching adolescents about their bodies. So I want to talk about a couple of things tonight. I feel like a lot of this is coming up for me because I've had several patient conversations recently where we've had in-depth chats about birth control and what do you do when you're a young woman and your period isn't perfect and your hormones could feel like they're all over the place and things aren't regulated. This is actually a time when a lot of practitioners will put these girls on the pill or the birth control pill. And it's not really the best approach in my opinion. So I want to talk about that, and then I'll field some questions at the end. So if you are a mom of daughters that will grow up and have periods and have questions, if you are a mom of adolescents, if you are an older woman who has mentees and other people in their life where you can help explain this to them, this video is for you. And if you are a young woman who's just trying to figure out her cycles, this video is for you as well. So I apologize for the road noise in advance, but I love doing these videos on my balcony. I just feel like it's really good lighting and I get to be outside, and with the quarantine I feel like we're all inside way too much. So I decided to move all my videos out here. So why don't we dive in? I guess the place where I really want to start is that when a young woman gets her period, the ages range. Girls get their periods young, sometimes 8 or 9, which in my opinion is too young, but that's a whole nother topic. And some women will get their periods around 11, 12, 13, which is about the average. And some women get their periods a little bit later, which 15, 16, sometimes 17. And it doesn't necessarily matter when you get your period, but when you get your period, your body is reestablishing a new rhythm that it never has before. So what happens when you get your period and when you go through puberty as a girl is that your ovaries, which for a really long time have just been waiting for this to happen, they've just been chilling out, your ovaries get a signal from the brain to start cycling, to start making hormones. And so your brain sends your ovaries two main hormones, FSH, which is follicle stimulating hormone, and luteinizing hormone, which is commonly known as LH. And so FSH is the signal that says prep an egg, get an egg ready to be released. And then LH is the signal that says, okay, release the egg, release the egg. So LH is the ovulatory signal, and FSH is the, what I like to call prep the egg signal. So what happens is when you have your period, you have essentially two phases of your menstrual cycle. You have the first half of your period, or the first half of your menstrual cycle, where you are having your bleed, and then you're having a time where your egg is being prepped before ovulation, and then most women will have an ovulatory event in the middle. And then the second half of your cycle is a more progesterone dominant time where your body makes natural progesterone because it has ovulated. And then once your hormones drop off, that actually signals the start of your period. So that's like period basics 101. So you have two phases of your cycle. You have the beginning phase, which is where you have your period and where you have a period of time where you prep the egg, and then in the middle you have an ovulatory phase, and then the second half of your cycle is where you have a progesterone dominant phase post-ovulation, and then you eventually have your hormones drop off and you actually get a bleed, which is your period. But for young girls, this rhythm is not established pretty much at all. When your brain starts sending your ovaries these signals of FSH, LH, your ovaries are like, wait, what? I have to make hormones for you? Oh, like, what is this? And also, there's 2 of us ovaries, so how do we figure out, like, which ovary is going to take over for this cycle and which ovary is going to make this hormones? Because what happens when you establish a normal cycle rhythm is that typically your ovaries will switch off every month. So ovary number 1 on the right will go, and then ovary number 2 on the left will go, and they usually about switch off. But as your ovaries are waking up and getting into this habit for when we start a period, menarche, puberty, the signals take a little bit of time to settle in. And so often what young girls experience is they experience a lot of PMS, a lot of premenstrual syndrome, so a lot of symptoms around the time that they have their cycles, around the time that they ovulate. And cycles can be really irregular, cycles can be really short, they can be really long, they can be really heavy, they can be really painful, they cannot come at all for certain months. And the thing that I want to impress upon you guys is that that's actually normal. It is normal for your cycle to be quote, quote, weird or to be irregular for the first several years that you are establishing a menstrual cycle. And that is because the brain and the ovaries are building what's called this feedback loop. So the ovaries make hormones in response to the signals that the brain sends the ovaries. And it just goes like this. So the way that I like to explain it is that the ovaries are learning how to receive signals from the brain, and the brain is learning how to send signals to the ovary. And it takes a little bit of time for the whole system to get in a groove. So what's actually really common is for girls to not really get a normal, what we call quote, quote, normal cycle for at least sometimes up to 3 years from when they start their period. So what is really common is that when women, when young girls get their cycle, they will say something like, you know, I have a lot of PMS, my cycles don't come every month, there must be something wrong with me. But they're actually in a very, very, very normal state. Your body is physiologically learning how to do this new thing, which is create hormones and have a period. And that takes a little bit of time to establish. So what I want to impress upon you guys is that it's normal for young girls when they just get their period to have irregular cycles, to have PMS. And one of the main reasons that is because of the brain signals and the ovary hormones. They're not quite coordinated yet, but also because ovulation is a really cool event that when you ovulate, you actually make hormones. That's how you make your progesterone hormone, and progesterone helps to balance out the estrogen that you make. So ovulation is this event that takes multiple different signals. You have to have the right amount of FSH, you have to have the right amount of estrogen, you have to have the right amount of nutrients on board, and then your ovary has to actually respond to the LH signal, that release egg signal from your brain to the ovaries to actually get an egg to pop out for you to actually ovulate. So ovulation is not something that your body just glides right into doing. It's not something that is really easy for your system to figure out. It takes time for a young woman to achieve what we call an ovulatory cycle. And one reason why young women often have a lot of PMS symptoms and have irregular symptoms all over the place and irregular cycles is just because ovulation is not something that is normal and typical for their body yet. So they experience more hormonal fluctuations, and they experience the negative effects of lack of progesterone that is not opposed by estrogen. So we can talk about that in a little bit. But your body is getting used to, number one, having a bleed every month, which is totally new for the body, but the body is also trying to learn how to ovulate, because the body has never done this before when you are just getting your period. So a lot of women will have irregular cycles that are hard and difficult, and that's because their body hasn't gotten into that rhythm yet. But it takes time for the brain and the ovary to learn how to communicate effectively. And Once that happens, then cycles will become more regular, they will become monthly, they will usually, we'll see PMS decrease, whatever PMS it is, whether it's heaviness, cramps, acne, headaches, bloating, breast tenderness. We'll see a lot of PMS go down, but once ovulation starts to happen, then that's when you achieve ovulatory cycles, that's when there's really a good rhythm happening. So often with young girls, the idea is not like, let's medicate you. The idea is, let's get you ovulating and let's support your body in having ovulatory cycles. And that is what the conventional system will miss when women do not have regular cycles, or they have hard periods, and they go into their gynecologist and they say, oh my gosh, I am 14 and I got my period last year and my periods are horrible. The first thing that they'll say to you is, oh, well, that's too bad. Why don't you take the pill? And the pill, if this is making sense, you guys, give me a thumbs up. The pill is a mixture of hormones that are synthetic. And synthetic hormones are awesome in the sense that they are really, really suppressive. So the pill was created to stop ovulation. Because the pill was created in a movement where women wanted their sexuality liberated, and we wanted the ability to choose when or not to have children. And one way to not have children is to suppress ovulation. So the pill was born out of that women's rights, kind of like the feminine women, what a tongue twister, the feminism movement, there we go. That was back in the early 1950s, 60s, 70s-ish, I want to say. I'm not an expert historian in this area, but the pill was born out of that that idea that women wanted to have choice about when they could have babies. And so what they created was a pill that was going to suppress a woman's ovulation response. So the idea is, if you can't release an egg, then you're not able to get pregnant, because then there's nothing to fertilize and you can't make a baby. So this was really, really appealing for a lot of women, because they could finally have sex with their husbands and not get pregnant every year, which was kind of how everything used to be. And I think that having that ability is awesome, but the thing that the pill really lacks is that it doesn't take into account what is normal female physiology. Normal female physiology is having a menstrual cycle every month until menopause, having ovulatory cycles, and then eventually going through a normal menopause and then having no more periods. We were designed to have fluctuating hormones every month in regards to how our menstrual cycle works. You know, if I drew out for you, you guys know those female hormone, I draw these out for my patients. They're a graph of all of the hormones in the cycle. We're created to have those ups and downs in our cycle, and we're created to ovulate every month, because if we didn't ovulate every month, it would be really hard to like make other humans, and making other humans is kind of important. So you know, when I was little, I used to think, oh man, like, why do I have a period every month? Because that sucks, I have to bleed every month. But you know, think about the women that are trying to have babies, they're trying to conceive, you know, they have to wait a whole month to try again in the ovulatory window. So it's actually kind of a blessing that we ovulate and we have cycles on a monthly cycle, though when you are a young girl and you are starting to get your cycle, it's really a drag, because suddenly you're bleeding every month or things are irregular. So I'll take that question in a second. So the pill was this thing that allowed us to suppress an ovulatory response so that we wouldn't get pregnant. But what they realized over time is that because the pill has a suppressive effect on the female hormones, it also will take away common symptoms of hormone fluctuations, like bloating, like male pattern hair growth, like acne. It will help calm down cramps. It will calm down heavy periods, those types of things. And gynecologists started to learn, oh, if I just give this woman a pill who's complaining of PMS symptoms, most of her symptoms will go away, and the bonus is that she won't get pregnant. And what woman doesn't want to get pregnant what woman doesn't want to not get pregnant when she doesn't want to? That was too many negatives there. But I think you know what I mean. Women these days, we want to get pregnant when we want to get pregnant. We don't want to get pregnant when we don't want to. And so a lot of gynecologists have really essentially enjoyed using the pill as a tool because it suppresses everything. And so if you suppress everything, you don't make your own natural hormones so that you don't have a natural cycle. And you're not ovulating so that you can't make a baby. But the problem is that when we put in synthetic hormones into the system and we just chop off our own natural signals, what that does is that creates a loss of the feedback loop that your brain and your ovaries are working so hard to establish that is considered normal. And so a lot of young girls are initially put on the pill so young, and so they never establish that feedback loop. So that when they are in their 20s and 30s, and they actually want to start a family, they come off the pill, and for some women it's an instant return of fertility, so you get your period back right away. But for a lot of women, it takes them a really long time to get an actual ovulatory cycle back. And if you don't have an ovulatory cycle, you're not dropping an egg, so that means that you can't conceive, which is a very big problem when you really want to get pregnant. So there is a deleterious effect of that the pill has on fertility. And so what we are finding out now is that with all of the chemicals that we put in our body, with all the extra stresses that we have as women, plus the pill, it's a lot for our system to recover when we actually want to conceive later down the road. So what I like to teach women is that you can learn what your cycle is doing and prevent pregnancy naturally. And there are so many natural ways that you can help PMS and you can help your cycle reestablish so that your cycle is normal and regular and easy and not full of PMS, and everything is a breeze. That's what naturopathic medicine can help these women do. But the problem is that they're given a pill so early on, they're given hormonal contraceptives so early on, which doesn't allow any feedback loops to settle in, and then it is essentially just a band-aid on symptoms. But for some women, it actually makes their symptoms worse, or their symptoms will improve, like they'll see acne improve, and then their heavy periods will improve, but then it will stop working, or they'll get negative effects from the pill, like weight gain, hair loss, facial discoloration, acne, I think I probably said that, such a common symptom, so many different things. So it really can go either way, and a lot of women, it changes their libido, it changes how they feel in their body, they don't feel quite normal not having a menstrual cycle, because as women we are designed to have a bleed, we're designed to have that detoxing feeling that having a period has. So a lot of women don't like those effects, and we can never guarantee how easy it is for your body to start having an ovulatory cycle again once you come off the pill. And what I see in my patients is that the longer that you're on the pill, depending on how early you were put on the pill, it's harder to get your period back, and it's harder to have a baby after the pill. And you actually have more negative symptoms coming off the pill than you would have if you had just fixed your symptoms or fixed the problem behind your symptoms when you were 12, 13, 14. But the generation that is growing up now, let's see, how would I explain this? Like, for me, I'm a millennial, and my mom, as a baby boomer, that's what she was taught, is go on the pill. So the baby boomers were given that as a dialogue, so they taught their millennial children that going on the pill is normal and great, but we're seeing that it's not really as great as we thought it was, and so we're having to rechange the dialogue around this, like with total overhaul. So with my personal story, I was never actually on the pill. My mom had learned about natural medicine and natural health when her parents died of cancer at a young age, but they were all lifestyle related cancers, and she was like, oh my goodness, how did this happen? And so she started educating herself about nutrition when I was young, 6, 7, 8. And so by the time I had my period, she knew how important female hormones were, and she could apply what she had learned and look back at her own fertility journey, and it just taught her so much. So I was never a person that was even given the option of a pill. The only option I was ever given when I was young was learn how to track your cycle and learn how your hormones are and learn what a normal menstrual cycle is, and then learn how to prevent pregnancy naturally, and learn how to read all of your body signals so that you know how to talk to your doctor. I went to a naturopath at a young age, so you know how to talk to your doctor and tell them what symptoms that you have so that they can help you actually resolve those symptoms. So I went to a naturopath starting back in when I was 12, and when I was 12, that's when I got my period, and so I was going through lots of changes, and they helped me so much. And I think as there's more information out there on the internet, more people are learning about this, so this is great. But part of what I do in my practice is actually I'll interact with women that are in their late 30s, 40s, 50s who have daughters who are adolescents, and they have done the research, and they are like, oh my gosh, I can't, in my right mind put my daughter on the pill, so what do I do? So I want to talk about that. I want to answer this question first, and I also want to talk about some things that you can do for PMS. I'm gonna write this down so I remember. Okay, so we're gonna talk about PMS. We're gonna talk about PMS and natural birth control. Gotta write it down with my llama pen. Thank you, Mom. I'm obsessed with llamas, if you guys don't know this. Okay, so let me answer this question first. What if you get your period every month, but your periods have gotten way lighter after getting off the pill, even if it's been over 5 years since getting off the pill? Is that considered normal? Okay, so this brings up a lot of good questions, a lot of good things that I could talk about. So where I'd like to start with this one, first off, when you're on the pill, what often happens is that you have a 30-day pill pack, and you have a break week where you're not actually taking synthetic hormones, but you're still taking pills. And typically in that break week where there's no hormones in the pills, that is when you actually induce a bleed, because you're not putting any more hormones into the system. Your body senses that withdrawal, and then it sheds the lining and you have your period. But that is not actually supposed to be called a period. What that actually is a withdrawal bleed from synthetic hormones. So it's essentially a pill bleed. It's not a real bleed. So I like to tell women, don't call bleeds while you're on the pill periods, because they're not actual periods. They are just your body sensing a change in hormone levels and shedding your endometrial lining, shedding all the blood that built up over that month. So number one, for answering this question, so women often will think about their periods while on the pill and their periods while off the pill. So like they'll be off the pill for a period of time, and they'll have a certain opinion about those types of bleeds, and then they'll get on the pill and they'll say, oh, my periods are so much better, they're so much lighter, blah blah blah. But they're not real periods, they're just your body being suppressed and your hormones being suppressed. So to answer this question, so women will often get will get a pill bleed. They will get a bleed every month if they have a withdrawal week on their pill pack. They will get one every month if you're taking it consistently. But then when you get off the pill, things are often very different, because those feedback loops, like we were talking about before, have been totally interrupted and need to reestablish. So for instance, this person is asking, if you get your period every month, but your periods have gotten way lighter after getting off the pill. So this is a person that was having regular bleeds, whether it was a real period or a pill bleed on the pill. Even if it's been over 5 years since getting off the pill, is that considered normal? So yes and no. It really depends what your history is with this. I always ask women, like, what was the reason why you got on the pill in the first place? Because that will change what we do and how we treat you, what natural options we give you. So what was your period like before you got on the pill? And then, did you have any type of bleeding while on the pill? What were your symptoms like when you were on the pill? And then since you've been off the pill, what has changed? The answers to those questions will really determine what is normal. I often will see lighter, well, I can go either way actually. I will often see lighter periods when things are reestablishing for women. So it could be that your estrogen levels just aren't high enough to have a significant amount of bleed. It could be that your detox pathways are gummed up. You don't have enough nutrients on board to build up. That's loud. You don't have enough nutrients around to build up a good endometrial lining, so it's not very thick, so you don't have very much to shed. There's lots of different things that could be at play. For those types of women, I'll often run a hormone panel, because if your estrogen is too low or your brain signals are off, we can test for that on basic hormone labs. So that is easy. But really it's just history, you guys. That really just tells us. And then she says, to give more insight, I had normal periods with a normal flow before the pill. Okay, that's awesome. And then after the pill, periods were lighter and shorter. Yeah, so things just could be suppressed. I'm not officially your doctor, so I can't make an official opinion, but that would be my idea behind possibly why that looks like that. Hi, everybody. Oh, and thank you for the hair comment. For those of you that don't know, I am getting married in less than 2 weeks, and so today we did, me and my hair gal, who is amazing, and friend, we did a little hair trial, and so this is it all undone and falling out, but it still kind of looks good, so it's great. Okay, so back to this topic. You're welcome. So now that we know that when you're on the pill, you have pill bleeds, you don't have real periods, that will help the next part of the discussion. So the reasons why women are put on the pill are usually for pregnancy prevention, or because they have bad periods and they need to get their cycles to be regulated. So if you have irregular and really hard periods, there's honestly, you guys, gobs of things that you can do. There are so many nutrients that will help even out your menstrual cycles. Zinc is one, magnesium is one, B6 is one, all B vitamins, in fact. Vitamin D can be helpful, antioxidants of all kinds, beta carotene. Your ovaries have a really, really high concentration of beta carotene in them, and women that are not eating nutrient dense diets for whatever reason, or are on a low fat diet, they're often not getting in enough beta carotene, and that slows down ovarian function and impairs it. So sometimes I'm doing beta carotene with people. Sometimes I'm just doing all of the antioxidants, because you need those to keep eggs healthy and happy while they're waiting to be used. What else? There's different herbs that are super helpful. For some women, I use Vitex. For some women, I use maca. There's a whole list of herbs flying around in my head that I could just throw out here. But it's really, really dependent on the person. So the other thing, before I get too deep into that, the other thing, it's really, really important to figure out the root cause behind any problems. So for instance, one of the main things that women complain about are, hi guys, one of the main things that women complain about are either periods are too heavy or they're too crampy. Or they're irregular. So I would do different things for women that have irregular periods than I would for women that have heavy periods, than I would for women that have crampy periods. And sometimes women have all of them. So we look at all of the different factors. So for instance, if you have any sort of thyroid imbalance, especially a slow thyroid, that can really throw off your cycles. So for a lot of women, I will do a full thyroid panel, like minimum, no questions asked, everybody gets that. I will always run a check on anemia. Anemia is a big reason for heavy periods. And it's kind of counterintuitive when you think about it. You'd think if you had, it's opposite in your mind. Does that make sense? Like you think if you're anemic, I would bleed less, but actually if you have lack of iron, you will bleed more. And the reason why is because when you are building up, so if this is a uterus, this triangle, when you're building up the sides of the lining, the endometrial lining, there's lots of arteries that will grow and create this nice luscious lining, because if you fertilize an egg, that fetus is going to divide and everything and develop, and then it's going to implant in that nice luscious lining to nourish the baby as it grows. So we build up that lining every month, and that's what we actually shed when we have our cycle. But you have arteries that grow and create this really luscious lining. And if you don't have enough iron in your red blood cells, the iron is like, it gives a very like a clamping down effect. So if you're anemic, which means that you lack iron because you lack oxygen carrying capacity, then you can't clamp down in those arteries that grow up in the endometrial lining. So when you are losing your lining, you're actually just gonna bleed a lot more, because I don't wanna say it's harder for it to clot, because that's an incorrect way of saying it, but it's that same effect of it can't stop bleeding as easily as someone that had enough iron in their blood. So I will always run an iron panel on people, and I will run an iron panel and a CBC. And the reason why is because you can be iron deficient but not anemic, and most practitioners will only look for anemia. The way that you look for anemia is to look in a complete blood count at an H&H, which is hemoglobin and hematocrit. If your hemoglobin and hematocrit are are low, they're out of range, then they will say, oh, you have anemia, here, take iron. But you won't get that take iron recommendation if you are iron deficient. And the way that we catch an iron deficiency is if we run an iron panel where we get a ferritin, which is indicative of iron storage in the body, or we run a serum iron, which tells us how much iron is running around in the blood at that moment, or we run a transferrin saturation, which is how much of the blood is saturated with iron, or we run a total iron binding capacity, which is like your iron hunger, like how much does your body want to bind iron, is your total iron binding capacity. So I hope you guys can see why that's different. I will often diagnose women with severe iron deficiency who are not yet anemic, because that iron deficiency for them needs to get really worse, really bad, for it to actually reflex into their red blood cells and show up for the traditional doctor to diagnose them. So a lot of women actually walk around being pretty decently iron deficient, and they have no idea, because it's not standard in medicine to run a ferritin, but a ferritin costs like, I don't even know, like $5. It's not even expensive, you guys. So all of you can ask your doctor to run a whole iron panel on you, along with the CBC and the typical stuff that they run. Like, it's not a hard ask. Like, asking for a whole thyroid panel can be a hard ask for a general practitioner, but not running just an iron or a ferritin. Most people will be okay with that. But if you are iron deficient, you are going to bleed a lot more. and it just, everything with your period is not going to be as easy. You know, you're going to be fatigued more easily, you're going to be more drained. That like that feeling when you're bleeding of like that if you like sit down and really feel into, as women we often get that. You know, if you're anemic, that's going to be like 10 times worse, or iron deficient, you're just going to feel way more depleted. So I always get a check on women's iron panels, because that can be a really big reason why they're bleeding too much when they have their period. Let's see, what else would I want to say about that? So you know, standard blood work to look at some of the main things why women have irregular cycles, heavy cycles, crampy cycles. Sometimes with women that have crampy cycles, they have a prostaglandin imbalance, so they have like an abundance of pain signals, and prostaglandins are these, I think of them as these like inflammatory signals that make cramps feel even worse than they actually are. Because a little bit of cramping with a cycle is normal, but it should not be enough to disrupt your life. It should not be so painful that you double over, and it should not be so uncomfortable that you're sitting there thinking like, oh my gosh, my cramps hurt a lot. They should be like, oh, I can feel my uterus working, but it's kind of annoying and that's it. It's not even really on my radar. That's what cramps should be like if you tend to get cramps. Because when you're sloughing blood off, when you're having your cycle, you are actually, your uterus is contracting, like micro contractions, not like big ones when you're having a baby, but it is getting rid of that lining. So it is normal to feel that. It just shouldn't be like crazy disruptive for you. So there's lots of different things that we can do to help with period pain. So sometimes I give things that will lower people's prostaglandins. Often I will prescribe ibuprofen, to be honest, because ibuprofen will lower your prostaglandins and will help you feel better. So that can be a really low force intervention. But there are herbs that do that as well that I really love, like tanicidum parthenium is a favorite. For lowering those prostaglandins, getting on a good fish oil, lots of different things. Sometimes I will give women like uterine spasmolytics to actually help the smooth muscle of the uterus and the skeletal muscle, like all of the types of muscle, just to chill a little bit more and be less like hyper-reactive to all the signals that your body's giving it to cramp. So that can be really helpful. Brooke is asking, do prostaglandin levels change month to month? What I tend to see with most women is you're either like, this is kind of hard to explain, and I'm gonna the physiologists that watch this might cry when I say this, but the way that I like to say it that helps people understand it is, you're generally, if you're a woman that tends to have really bad cramps, with those women I usually say that they're a prostaglandin like overproducer, like that signal is on overdrive, versus women that don't get really bad cramps, they're not like that, they're not wired that same way. So do prostaglandins levels change month to month? Maybe. Sometimes your lifestyle, I'm smiling because I'm thinking about myself, your lifestyle choices can influence how much prostaglandins you make. So just to pick on myself, the more coffee and the more caffeine that I have, the worse my cycles are, and it's noticeable in terms of acne, cramping, feeling of like when I'm bleeding, all worsened by caffeine, because caffeine essentially impairs the detox of estrogen, which makes me feel all of those symptoms. But for some women, prostaglandins are the thing for them that we have to work on and always modulate. So I don't normally I see symptoms change monthly, like what I was just picking on myself about, but if you're a big prostaglandin maker as a woman, you tend to have heavier cramps, it's usually a pathway that we always have to work on. And yes, lifestyle, diet, exercise modifications really, really help. So say you have habits that really, really support you. Like for me, it's not drinking coffee and working out every day. And then you're not doing those things, then yeah, you would have more prostaglandins that month. But they're not necessarily going to fluctuate wildly, if that makes sense. At least that's not what I see in my practice at all. I see women either have one tendency towards one or the other, more or less prostaglandins. So if you're a crampy type of menstruator, then you're probably a prostaglandin person, and we need to help with that. Yeah, I tend to have very normal cycles, but sometimes I have bad cramps, and sometimes I don't notice them at all. Yeah, so Brooke, look into all of your lifestyle stuff and see what you've what you have let slip. Let slip. Or things that you've totally forgotten about that were actually really helping and supporting you. We all have those as women, and so that's why we can think of periods like being a monthly report card. And sometimes it takes about 3 months for things to actually catch up to the ovarian level. So when we're doing a lot of these treatments to help with PMS or to help with bleeding or help with cramps, I usually will say, hey, you might feel better next cycle, but it might take 3 cycles for this to really trickle down all the way to the ovaries. What about spotting relating to ovulation? Okay, so that's kind of another topic for another time. But sometimes spotting related to ovulation is due to your endometrial lining being unstable. And sometimes that's due to fluctuations of estrogen right before you ovulate, which is common because FSH will mess with your estrogen levels. It usually will boost them. But for some women, things shift a little bit. But I should do a video on mid-cycle bleeding because that does happen for a lot of people. Okay, so we talked about PMS. The other things I wanted to talk about, because this video is for young girls that are just getting their cycle reestablished, the thing that I really want to impress upon you guys is that if you have bad PMS, natural medicine can help you big time. You don't need to go on the pill to regulate your cycle, and if you do get back on the pill, all you're going to do is delay the inevitable. Eventually you're going to have to get off the pill if you want to have babies, or if you want to have a normal menopause, or whatever it is in your life that's a goal for you with your fertility. Eventually at some point you're going to have to come off the pill, and you're going to get rebound symptoms. There's very few women that I work with that don't get any negative effects from coming off of the pill. So it's either you deal with it when you're young, 12, 13, 14, let's be honest, you guys, everybody is having an awkward stage around 12, 13, and 14. So you might as well write it out and deal with it then, versus going back on the pill, or at least this is my own personal opinion, then, 25, 30, 35, be coming off the pill and be dealing with adult acne and hair loss and weight gain and all those different things. So I am pro women figuring out the PMS and the reason why their cycles are irregular or heavy or crampy from the get-go. One reason why your cycle might be irregular is just because your body is reestablishing, or I should say establishing, a menstrual rhythm for the first time ever, and it's learning how to do that, and your brain and your ovaries have to learn how to talk, and that takes time. So women can have irregular cycles all the way from 1 to 3 years after they start their period. So if you have irregular cycles when you're 15 and you got your period at 13, that can still be normal. But what we need to do is step in with nutrients and different herbs to actually help the rhythm establish and get concrete. Because then once you have regular ovulatory cycles, that's going to support you as a woman for all your goals, because we want to make progesterone, we want to ovulate regardless of our fertility goals. Whether you're a woman that never wants to have kids and you're set on it, I still want you to ovulate, because ovulate is how you're going to make hormones, and we need to make hormones as women. On the converse, if we were to talk about men make testosterone all the time. And women make hormones all the time, but we make them in a monthly up and down. Men are making testosterone every day, but their testosterone is highest in the morning and lowest at night. So we have like a month to accommodate, but they're on a shift every day, which is kind of interesting. But we would never ever give a testosterone suppressing drug to a man unless there was some like big medical reason, like cancer, or transgendered people. That's a whole nother topic. But we usually don't do testosterone suppressing medication for men because men need their testosterone to be men. I believe it's the same with progesterone and estrogen with women. We need those hormones to be women to function optimally, because if we don't have good estrogen, progesterone, we're gonna feel crazy and our brains don't work as well either. So estrogen has a huge effect on the brain. So we wanna get these PMS symptoms ironed out early on when you're young, because you're gonna have to deal with it later if you don't figure it out. So that's my 2 cents. For women that are really not wanting to get pregnant, there are options for you. There are IUDs, which can be really great for some women and really not great for other women. So definitely talk to your doctor about the pros and cons. I think I'll do a separate video on my take on different birth controls, because I've been talking about this a lot lately with patients, and it's been very relevant. But IUDs are a great option for some women and not for others. There's hormonal IUDs, there are non-hormonal IUDs, so that can be very, very helpful. Condoms work really well when you use them appropriately. And then there's also something called the fertility awareness method, which is when you are aware of your fertility and you track your fertile signs so that you can prevent pregnancy. And this is different than the rhythm method. This is different than the pull-out method. This is different than any of the family or Catholic associated methods that have a lot of bad rap in the scientific community. The fertility awareness method is looking at various different symptoms that we women get because we have cycles, and we track them so that we determine when our fertile window is and when our fertile window isn't. So whether we are choosing to engage in unprotected sex or a barrier method, we can be choosing wisely for where we are in our cycle and how likely or not we are to be pregnant. Because what a lot of people don't know is that I love talking about this, the egg that we ovulate as women, the egg is alive and viable to be fertilized for about 12 to 24 hours. 12 to 24 hours. So let that sink in. So women are not fertile their whole cycle, and women cannot get pregnant on every day of their cycle. And anybody that tells you otherwise is just wrong. There's nothing wrong with them, but they're just wrong. They just have misinformation, and that's taught a lot in schools. Probably to get kids to wear condoms when they are exploring, when they're young. But women are not fertile every day of our cycle. When we release the egg, that egg is viable for 12 to 24 hours. What increases the fertile window from 12 to 24 hours, though, is the cervical mucus that women get that helps the sperm swim to where they want to go, which is to the egg. So fertile cervical mucus, that egg whitey, slippery, wet cervical mucus that most women get in the middle of their their whole menstrual cycle, actually gets the sperm to where they need to go. So if you're trying to make a baby, cervical mucus is really awesome. And when we're trying to figure out if you're ovulating, cervical mucus can be a great way to show us that you're ovulating or not. But cervical mucus will extend the fertile window. So, and then the other thing to note is that sperm, once inside a woman's body, can live for 5 to 6 days. So you can see how the fertile window goes from that 12 to 24 hours up to, usually for most women, it's about 7 days. But when we are doing different methods in the fertility awareness method to prevent pregnancy, there's different ways to track your cycle, and there's different rules to apply to your own cycle to then not get pregnant. So that's a whole other discussion, but I wanted to throw it out there for women that are looking for a natural birth control option. You can track your cycle. And you can prevent pregnancy very easily if you learn the rules of fertility awareness method, whichever method that you pick, and that's a whole other topic. But it is, I think, like something 99% effective, 99.4, something like that, when used correctly. And that's pretty much as good as any IUD or any birth control pill. So the only way to officially not get pregnant is abstinence. That's the only 100%. That's why there's never 100%. So if you really don't want to get pregnant, don't have sex. It's a rule. But if you are wanting to have sex and also prevent pregnancy naturally, there are ways to do that that are not hormonal contraceptives and that are not IUDs or implants or condoms. So throwing that out there. If you guys want a video on that, I can do a video on fertility awareness method stuff. It is near and dear to my heart, and it works. And comment if you think that's a good idea. But just to kind of recap, I wanted to do this video for mothers of newly cycling girls and for girls that are figuring out their bodies. You know, this 12 to 18, 19, 20 time frame when your cycle is establishing. When you first get your menstrual cycle, your body has to learn how to talk. You have to reestablish, or you have to establish, a feedback loop from your brain to your ovaries to tell your ovaries to make hormones and to ovulate and to have a menstrual cycle. And that takes time to establish. So it is normal for teenage women who have just gotten their cycles to have irregular cycles up to 3 years after they get their first period. It's normal. It doesn't need to be medicated. You don't need to go on the pill. And you have natural options to treat any sort of PMS that can come up, whether it's skipping periods, painful periods, cramping periods, heavy periods, whatever it is. There are natural treatments that can help. I talked about them later on or earlier in the video, so you can go back and listen to those. And there are natural ways to prevent pregnancy, and it takes a little bit more diligence than popping a pill every day, but they work and they're effective, and they're, I consider, easy. Nothing in life, nothing in life is ever free or given to you. You always have to work at it. So pills, for instance, is something that can just be given to you, and it's just like the taking a pill culture, but they don't come without side effects. So nothing is ever easy. Everything's a choice, and it's just dependent on your goals and where you're going in life and what you have going on in your life currently. So there's no easy answer for everybody. It's always a conversation. With all of my patients, I always sit them down. We talk about them in terms of what they're going on in life, what their goals are for fertility now and in the future. We talk about what I see in my patients, what I tend to recommend to patients, what I see work, don't work. We talk about my biases so that they know where my biases, where I come from, and then we discuss all the risks and benefits of all the possible options that are out there. So definitely, if you don't have a practitioner that does this with you, find a practitioner that will legit sit you down and say, look, I'm biased in this way because I think it's awesome, but also there's all these other ways that could be really, really great too. So have a doctor that does this, and a lot of us are on Instagram and we're super cool, so give us a follow, send us to your friends so they can get educated too. But there should always be a discussion about what your goals are now and in the future, because that makes a big difference how you're treating your PMS as a young woman and what birth control you're going to pick. Oh gosh, there's some birds that live like in this one little spot in the roof, and the bird almost like flew into the balcony. So if you hear all the weird flapping on the video, it's because they live like right over there. Anyways, so there's lots of things to consider when you're a young girl and you have bad periods and your cycles are re-regulating. You should not just blindly go on the pill. The pill is really not the answer. And I know a lot of women that I work with can attest to the pill is just not perfect. The pill serves a purpose. So I'm not anti-pill. I am pro-educate you so you know what you're getting yourself into. But there are some women that I work with who are on the pill or who choose to go on the pill for a period of time, and we help their body through that. which is a different type of discussion. But that's what we talked about today. That's what we have. Any questions for all of you guys that have tuned in this whole time? I'm gonna scroll up, make sure I didn't miss anything. I hope all of this makes sense. If you're just joining, we were talking about what happens when you are a young woman and you get your cycle, in terms of what is considered normal, what's not, how we treat different things that are not normal. Thank you everybody for coming. I'm gonna wave at all of you guys. It was great. Any last questions before I sign off for the night? For those of you that don't know me, I'm Dr. Meg. And I do these videos every Monday night at 5 p.m. So if you liked this, then there will always be more. And I always post these videos on YouTube as well. So go find me on YouTube, give me a subscribe, share me with your friends, you guys. That's really the most helpful for me, is the more that I can tell people about how awesome natural medicine is, the better off we are, because a lot of people need natural medicine, and it's a huge passion of mine, obviously, because I'm a naturopathic doctor. So thank you all for tuning in. We will be back next week, probably continue our weight loss series. We've been doing a weight loss series on and off. I've been breaking them up with other topics to keep it exciting. But yeah, and that we'll have probably 2 more lives, 1 or 2 more lives, and then I'll take a little bit of break because I'm getting married very soon, which is exciting, and then we'll get right back to it. Thanks everybody for coming, and have a great evening. It's beautiful here in San Diego. Bye guys.